Hi, I'm Susan Moore, and today I am at North Colorado Medical Center in Greeley with Banner Health in Spirit of Women. I have had some experience in emergency rooms lately, and I thought it would be really interesting to talk to an emergency room doctor who sees my kind of injuries and your kind of injuries every day. Dr. Ledges, welcome.
Thank you. It's nice to be here.
So, an emergency room doctor, first of all, where do you practice here in Greeley?
I practice at each of our two emergency departments. Here are our main emergency department on campus at North Colorado Medical Center, and then also at our freestanding emergency department on 71st and 20th.
So if somebody had medical emergency, what's the determining factor in choosing one over the other?
Well, it's a couple things. They're both emergency departments staffed by board-certified emergency physicians and emergency nurses and techs. Both facilities have very similar capabilities. So one determination would be location, if one is more convenient to you than the other. Another determination really has to do with severity of the problem that you need evaluated. Our freestanding emergency department is not attached to a hospital, so if you would need to see a subsequent specialist or be admitted to the hospital, then you might need to be transferred to the main campus here in town.
On 20 and 71st?
Correct.
Right. So if you think you're going to need a surgeon or something more complex, it might be best to come to NCMC main campus?
Potentially, and one of the guidelines that we use and that we share with our paramedics is that if there's a high likelihood that the patient will need to see a cardiac surgeon or an orthopedic surgeon, for example, or need to be admitted to the hospital, then it might be better to bypass the freestanding ER and come straight to the main ED here at North Colorado Medical Center.
Okay, now, emergency room or urgent care, what is the difference in those two?
Right. So the differences between urgent care and, in this example, a freestanding emergency department really come down to the level of services that are available at each facility. And at our freestanding ER, most patients wouldn't see a difference compared to a main ER. At an urgent care, the services that are available are much limited. They might be able to take x-rays, but there might not be, say, CAT scan or ultrasound readily available. They also might not have all the additional staff, nurses, respiratory therapists, et cetera, to administer more advanced treatments.
Well, that's interesting to know. I guess that makes perfect sense. What are some of the new things that you're treating with in the emergency room these days, doctor?
Well, it's June and the weather is lovely, and so trauma season has come in like a lion. So we're seeing lots of injuries and accidents, lots of falls and car accidents. So the trauma season is here now.
Okay, so besides the scrapes and bumps and the accidents and things, what about somebody that felt they were suffering from a heart attack?
Right, so if you think you're having a heart attack, you're having chest pain, you're short of breath, or you think you may be having a stroke or some other severe medical condition like that, the first thing you should do is call 911. If you're nearby a hospital and have a choice, your choice should be the emergency department here at North Colorado Medical Center, where we have all those additional specialties, and we have the cath lab and neurologists to treat those more complicated conditions.
All right, well, you have a 7-year-old and a 4-year-old. Do they ever get scraped up? Do you see them in the emergency room?
Knock on wood, neither my son nor daughter have had to go to the emergency room, with the exception of occasionally visiting me at work.
Oh.
But my boy is very much a boy, and he gets his share of cuts and scrapes, absolutely.
Well, he's lucky he's got a dad in the house. So when a child does have to come to the emergency room, what kind of things can a parent do to prepare a child for that? Or is there any preparation?
Mom or dad can explain that we're here to help, and that mom and dad can be with them the entire stay. And we've done a bunch of things in our emergency department to bring more of a pediatric feel, more of a softer touch over the last couple years. So we have some dedicated pediatric rooms throughout our emergency department with murals and different themes based on different ages. We also have a couple pediatric suites, what we call them, where it's a standard patient room, but attached to it is a small little suite with murals and interactive projector and games for the children. So that helps both the patient, helps alleviate some of their fears, helps mom with some of her anxiety perhaps, and then if mom happens to be bringing the other kids who may not be sick,
Right.
It's a great opportunity for them to be occupied while mom's focusing on the sick child.
Very nice, very nice. Well, I hope your summer isn't too terribly busy, Dr. Ledges.
Well, thank you. We'll see. It's early.
It is. We thank Dr. Ledges for taking time out of his busy schedule to talk to us a little bit about emergency room care. I'm Susan Moore for Spirit of Women, Banner Health, and North Colorado Medical Center in Greeley.